My name is Michael Hamill. I am the Vice President of Care Management at CRF Behavioral Healthcare, and my job is to oversee both of our ECM and CS programs called Healthy Connect Adult and Healthy Connect Youth Services. Both of these are programs, like I mentioned, under CRF. CRF was incorporated in 1977 as a nonprofit, and now there are over 30 behavioral health programs throughout San Diego County. At Healthy Connect, well, we provide enhanced care management, community supports, housing services to Medi-Cal beneficiaries with complex chronic and medical behavioral health conditions. We operate throughout San Diego County and provide services to almost every ECM population. Healthy Connect is our CalAIM programs. Right now we have about 1,200 members that we are supporting throughout the community. We are community-based. We're part of a really well-established nonprofit organization. It's been providing services in the county for decades. We have numerous partnerships with other organizations. Our staff are really well versed in San Diego system of care as a whole. Our lead care managers are out in the community. They're meeting members in the field, and we're engaging with them directly. Our youth program specifically has been working with a member falls under the child's serious mental illness and substance use disorder population. So you've been with us for just over a year. At the time of enrollment, the member and family had requested assistance with getting connected to behavioral health services, community resources, transportation, and advocacy for the member's IEP plan. Their school. Since the member has began working with us, our lead care manager, they have been connected and started receiving food, clothing, utility assistance, transport resources, just like really the whole gambit, and connecting them to everything that they were asking for. They were also struggling with the 90-day eviction notice, so our lead care manager linked them to the community supports housing, transition and navigation services to help get them established with some permanent long-term housing. The referral was approved really quick, and within a couple of weeks, the housing specialist was able to find appropriate housing that met the member's needs and also accepted their voucher. The housing specialist also was able to coordinate a deposit, which was able to cover the family's security deposit and their first month's rent. So that was a really big deal. The whole family actually is now living in permanent housing, and they've transitioned into the tenancy and sustaining services of community supports, just to further support their long-term housing goals. The member is still working with our lead care manager with enhanced care management, and they work together to support their behavioral health, their transportation needs, and they're just continuing with those educational and financial goals as well. It really comes down to just having high standards of care for our members. The whole system of care for health in general, it's really extremely complex. We want to be able to help our members get access to good care so that they can experience a better quality of life. This happens through multidisciplinary coordination, collaboration, as well as expertise and care management in general. Working with external providers, advocating on members' behalf, these are all things that our members need a lot of help with, and we're there to support. Some other things we do, we utilize all of our electronic health systems. There's a lot that we work with. It can be both a blessing and a curse, but at the end, it always ends up benefiting the members' care directly because it gives us more access to information, and helps us connect with other providers as well. The last point is physically meeting members where they're at, providing multiple engagement attempts throughout each month. Members can be more difficult to get a hold of. They got a lot of stuff going on in their lives, so the continued engagement is found to be really effective. It's more about engaging with the community as a whole. So we try to engage with all of our members as well as providers, face to face, and make those connections. Telehealth, it's a great resource, but to successfully connect with these individuals who do qualify for ECM and CS, face-to-face outreach support is paramount. When we're talking about connecting with those providers in the community, it's building that network of resources that helps you stay up to date with the local systems of care, stay up to date with policy and all those changes so that you can be ready to respond. Another big thing that we do here is we employ manageable caseload sizes for the direct care staff. We think it's very important to allow that manageable caseload so that staff can have a good quality of life for themselves and then be better equipped to provide that for the members as well. We are part of the CPI collaborative group as well. So we work with those providers. So that's another one of those recommendations we have. It's a great opportunity for providers in the community to share resources, things that are applicable, typical common ECM barriers that we all experience. We can really tease those out. It offers a space to discuss and review all these DHCS policy changes, care plan guidelines, ultimately helping us all gain a better understanding of state and county level updates.